So I just wanted to introduce Saoirse. Saoirse is a clinical nurse specialist with 20 years experience in gynae, and Saoirse is an expert in prolapse management. So what we wanted to do is just let you know that when you do come for prolapse, even if you need surgery, surgery is not first line. So Saoirse would be the first person that you'd meet. She is an expert in prolapse management. So what would you recommend as the first line treatment?
So definitely when you come in to meet me, obviously we'll take your history and what kind of symptoms you're having with the prolapse, and we'll do an examination on the day. But definitely we need to start with you seeing a women's health physio, because working on building muscle within the pelvic floor is really, really important. It's important if maybe we are going to look at inserting a pessary ring for support, but also if surgery is something that has to happen down the line, you need 6 months of intense physio to really build up the muscle. And because what can happen is that the surgery might work for a little while and then you can get a prolapse again. So it's important that the muscle is constantly being worked on, and I do describe it as, like, say you're going to the gym and you're building the muscle in the arm, you have to keep going lifting the weights to keep that strength up. It's the exact same thing in your pelvic floor. So
Absolutely.
You need to be doing them every day, and that's for life. It's not just once off. And then if we get to the 6 months where we've maybe done the physio, you've tried a pessary ring, it hasn't been successful, then we need
the vaginal oestrogen.
Yeah, vaginal oestrogen definitely for everybody is really, really important, because that can help with obviously muscle tone, hydration, strengthening your tissues, and especially if you have a pessary ring in there as well, you need that as well for support. But if all of that hasn't been effective, then we probably need to do a test called urodynamics, just to make sure your bladder is functioning properly, and then it'll be to meet you, Orla, then to look at surgical option then as the next stage.
Absolutely. So surgery isn't the first step. There's lots of steps that we need to do prior to surgery, because surgery is not sustainable for the long term, and your prolapse might resolve. So it's assessment with Saoirse, vaginal oestrogen, referral to specialist physio, you may need urodynamics, and you may benefit from a ring. And then we decide about surgery.